how do you see how public health and the policies that kind of affect healthcare, how do they kind of work together? How do you implement some of these things? Because this is something we're not very used to, being kind of physicians just like in a hospital on a day-to-day basis.
Well, I think we need to be more intentional about thinking about the health of populations as well as the health of individuals, right? So we all went into medicine to help the person in front of us, which is amazing. But I know a lot of us think about as families units, as community units,
Yeah.
right? And then as what I'm thinking about these days is one country and how do we be the healthiest? And I think we learned during the pandemic the silos between public health and healthcare really hurt us going
Yeah.
into the pandemic. Whether it was right, just the data sharing silos themselves, right? So if we couldn't see the same problem, we couldn't solve it together, and we didn't have that interconnectedness. And look, and this is because we made a generational investment in data in the health delivery system.